Hello everyone, my name is Ashish Rahi, and today my video is about quality in healthcare. The quality in healthcare department like civil hospitals, medical hospitals and all foreign medical hospitals is very essential for the effectiveness and safety of the patient. So in this video we will discuss about the quality in healthcare and their products and their safety. The quality in healthcare is very essential for the following reasons that are effectiveness, achieving outcomes as desired by doing right things. For the efficiency, it relates to the maximizing the quality of healthcare delivered or health benefits achieved for a given unit of healthcare resources used. Equity is also related to the providing healthcare of equal quality to those who may differ in personal characteristics. Patient centeredness relates to the meeting of patients' needs and preferences. Safety, avoiding harm to the patient from care that is intended to help them. And timeliness, it relates to the obtaining needed care while minimizing delays. So these are the factors which is very essential to the quality in healthcare. And in this slide we will discuss about the dimensions of quality. The dimensions of quality comprises of three parts, that is, first is the process, second is the structure, and third is the outcomes. How we process the dimensions of quality is related to the planning of the qualities and structure of the qualities material, and what are the outcomes. It will give a good better qualities of healthcare department. The initiatives under the quality assurance programs are comprises of many committees like NQS, Lakshya, Suman, Karnal, Mera Aspatal and Muskan. And we will firstly discuss about the NQAS. The NQAS is National Quality Assurance Standard. The aim for the National Quality Assurance Standard is to ensure the quality health service through National Quality Assurance Program, ensure the advocacy and implementation of global best practices, evidences and policy recommendation to reduce the harm to the patients and enhancing the satisfaction experience among the users of the government health facilities and reinforcing trust in the public health system. The guidelines for the NQOS is the formation of quality assurance team at the facility level, internal assessment, patient satisfaction survey, and the key performance indicators, and quality policies and objectives, and undertaking rapid improvement events like setting up an objective root cause analysis, measuring indicators, and the plan and checking and recheck, and the medical and health and death audits, and the standard operating procedure and work instructions, and the external quality assurance of measuring equipments and laboratories, competency and performance assessment, development and implementation of risk management framework is the operational guidelines of NQAS. In this we will first discuss about the empanelment of external assessments and selection of assessment for national assessment and certification cell at NHSRC certification process, document the verification and clearance, compliance criteria, validity of the certificates, surveillance assessment, and recertification virtual and online assessment and its protocols. So This is the NQAS, that is National Quality Assurance Standard guidelines and implementation and work in this video. This is the National NAQS Facility 2021-22 status of district, like district hospital. This is the demo of district, like baseline assessment, internal assessment, state assessment and national assessment. So by the year wise we will give the district wise and PSC CSC wise internal and external assessments to the benefit of the hospital. Thank you. So this is the NQS, National Quality Assurance Program, for the quality assurance of safety of civil hospitals and government hospitals. Thank you.